Welcome to Let's Talk Wellness Now. I am your host, Dr. Deb, and today I have the pleasure of meeting with Dr. James Greenblatt. I've known Dr. Greenblatt for a very long time. We started lecturing together, over 15 years ago. And he is amazing practitioner. Dr. Greenblatt is dual board certified in psychiatry and internationally recognized as a pioneer in functional and integrative psychiatry. He's widely regarded as the leading expert on the clinical application of low dose lithium for mental health. Dr. Greenblatt has spent more than 30 years advancing precision medicine based approaches that move beyond symptom management to address the root causes of mental illness. And after earning his medical degree at George Washington University, Dr. Greenblatt completed his psychiatry and residency there as a fellow in child and adolescent psychiatry, joined Johns Hopkins Medical School, and he currently serves as an assistant clinical professor of psychiatry at Tufts University. He is a prolific author. Dr. Greenblatt has written 9 books, including his newest book, Finally Hopeful, available in January of 2026. So we can ask him about this today. And his bestsellers, Finally Focus, The Breathwork Natural Treatment Plan for ADHD, Answers to Anorexia, Functional and Integrative Medicine for Antidepressant Withdrawal, and Nutritional Lithium, and Untold Tale of Mineral and Transforms Lives that Heals the Brain. He has founded in 2019 the Psychiatry Redefined, a leading educational platform training clinicians worldwide in functional and integrative psychiatry. He is a sought after international speaker. Dr. Greenblatt regularly lectures on nutritional psychiatry and the transformative role of functional medicine. I am super excited to have him here with us today. This is going to be a pleasure. You guys are going to love this conversation that we are going to have. And I am going to pick his brain today on functional and integrative psychology and psychiatry and combining nutrition, biochemistry, and lifestyle with mental health care. I'm really, really happy to have Dr. Greenblatt with us. I am going to bring him on and we are going to have this amazing conversation with my friend. Welcome back to Let's Talk Wellness Now. I'm your host, Dr. Deb, and I have with me Dr. James Greenblatt, who I have followed we were just chatting about this for over 20 years. He is amazing in what he is doing. And we are going to have this conversation today about integrative psychiatry and the future of mental health. So welcome to the show, Dr. Greenblatt.
Thank you, Deb. It's good to be with you.
Now, you've been pioneering this integrative psychiatry for decades. What really inspired you to bridge nutrition and psychiatry long before it's become mainstream?
I developed an interest in college, studying nutrition. And then I remember writing papers on orthomolecular psychiatry, high dose vitamin B3 for schizophrenia. So I really did not think I'd be a psychiatrist. I wanted to be a pediatrician when I went to medical school, but just early interest in nutrition and brain function. And it's been my career now for 30 plus years.
Wow. Can you define what integrative psychiatry actually means and how it's different from traditional psychiatry for most people who wouldn't be familiar with that term?
Sure. I mean, I have to add the word functional as well. I mean, I think, I call myself a functional psychiatrist, but for most of my career and every book and everything I did, I would have to use words like functional and integrative medicine for mental illness. And, I define integrative medicine as the adjunctive lifestyle, mindfulness, and diet, sleep, and exercise. And I kind of use the term functional for kind of a deeper root cause dive, looking at nutritional deficiencies, looking at hormones, looking at genetic. And, to treat patients with mental health challenges, we need both integrative and functional medicine.
That's awesome. In our integrative space, we often kind of joke that there's no such thing as a Prozac deficiency, right? Can you explain to our listeners how nutrient deficiencies, gut health, or inflammation can play a role in mental illness?
Sure. I mean, I think the most important beginning of this conversation would be that, 10 people with depression, there might be 10 different underlying factors. And we do know that there's not an antidepressant deficiency. So we have to look deeper. And that's just different than our current psychiatry model where it's just symptomatic based medicine. Everyone who's depressed
Mhm.
gets an antidepressant. And by looking at functional integrative medicine, we're looking at B12 and vitamin D and zinc and magnesium. We're looking at hormones. We're looking at the gut. And we're trying to determine what might be either causing or contributing to that person's depression.
Is there a particular flavor that you see more commonly with others, like depression versus anxiety versus bipolar? Is there a particular underlying factor that you see more commonly than others?
Well, the short answer is no. And that's why this work takes time because you have to think. Every patient that walks in the office is different. I mean, I think the overarching umbrella is nutritional deficiencies, whether
Mhm.
regardless of weight, regardless of diet. I mean, I have people coming in who've been eating, these ketogenic or paleo diets, perfect organic foods and are profoundly nutritionally deficient. So
Wow.
I think nutritional deficiencies would be number one, and then the whole host of infections and hormone problems and inflammatory issues related to celiac disease is really
Mm.
common in the mental health space that's ignored.
Yeah, celiac disease is really not paid attention to much, other than thinking that it's damaging the gut. They don't really think about all the other aspects of the body that are being affected by the gut not being able to absorb the nutrients properly and then utilize them properly. It's really sad.
We find out, and there's research to support it. That's the tragedy. This is
Mhm.
not something as clinicians that we found. We have many, many years of research showing high rates of anxiety and depression, amongst those with celiac disorder because of this chronic malnutrition.
Mhm.
And many patients present without any GI symptoms, just mental health
Mhm.
complaints, but nobody's looking at celiac.
I'm sure there's people that are listening to us thinking there's no way that everybody who's depressed or anxious has a nutritional deficiency when we're live in a country where there's so much abundance of food and the obesity rates are high and most people are very plump. How could those people be deficient in nutrients? What do you say to people who think like that?
Yeah, I mean, I think that we have what's called high caloric malnutrition. So regardless of weight, I would say the vast majority of patients with a mental health issue, I would say my best guess would be 90+% that
Wow.
we would find nutritional deficiency. And part of this we've discovered is genetic, people having kind of genetic needs for higher amounts of certain micronutrients. Some of it is just the kinds of foods people are eating, the kind of ultra processed food actually
Mhm.
strips the body of micronutrients. So it is just so common. And many of these tests are pretty simple that your primary care doctor could do in the office.
So, traditional labs can identify some of these nutritional deficiencies. They don't necessarily have to invest thousands of dollars in advanced nutrient testing to find these things out.
Absolutely. I mean, I think, oftentimes when we're working with a patient who has failed traditional psychiatric treatment, we do need some functional testing. But I'm quite convinced we could change the trajectory of our mental health epidemic in this country by some labs that are covered by every insurance company on the planet. Like people think of vitamin D as, building bones or immune
Mhm.
function. It has dramatic relationships and mental health problems demonstrated over 30 years of research. So vitamin D and B12 and folate, all simple blood tests that are covered by all health insurance.
With the change of genetics, MTHFR is so popularly known these days. It's probably the most popular genetic mutation that people know of. And in the mental health space, it plays a significant role as well in that absorption of B12 and folate. How do you look at MTHFR mutation within inside the mental health world?
Well, I think it's a critical, it's required on every patient that I see, and I've been known to say it would be considered malpractice for psychiatrists not to test for the MTHFR gene because most of my career I've spent working in inpatient psychiatric hospitals and residential. So seeing those individuals that have failed outpatient treatment, so really struggling. And one of the most common things I've been seeing for 30 years are those psychiatric patients not responsive to traditional treatment oftentimes have one of the more significant MTHFR variants. And so we started doing the testing in the hospital, and they came back with these, variants and treated with folate. The medicines worked better and their depression got better. It is simple and essential. So the integrative community, our community is aware of it, but our
Mhm.
conventional psychiatrists are not testing for MTHFR.
It's so sad, isn't it? Because it's such a simple test and can make such a big difference in people's lives. I know even in the OBGYN community, we're not looking at MTHFR, and yet we're giving women all this folic acid that many of them might not be able to actually utilize. And in my opinion, we're doing a disservice to those women and the children that are being born to them for that.
Yeah, no, it's frustrating when there are clear, simple treatment interventions that could make major difference in people's lives that are just not incorporated into kind of routine treatment model.
How come we see some people with MTHFR mutations or gene mutations have depression and anxiety that is so severe, and then other people seem to have absolutely no problems with mental health at all, and they have a similar profile?
Yeah, I mean, that's just a great example as, genes aren't our destiny. It's just kind of a vulnerability. And, we actually, when we were in the hospital, we tested hundreds of people and staff as well. And, there are people going to be live to 100 and have these very vulnerable MTHFR genes.
Mhm.
So it's not the genes, I call it that genetic environmental dance. So if we add that genetic vulnerability and maybe we add a Lyme infection or a chronic stress or a B12 deficiency or celiac, or we could list 100 things, stress and inflammation probably being the most significant.
Mm.
With that genetic vulnerability, that's where, the implications of treatment come more defined.
What do you think the role of trauma plays in all of this too with the genetics? Do you think that trauma that people are living with today makes a big impact on their genes and how their genes are being turned on or off?
Yeah, I mean, we know trauma is kind of, sets the stage for so much psychiatric illness. I think in my community of mental health professionals, we kind of use the trauma as an excuse to not think of the biology. And trauma affects the biology.
Mm-hmm.
So without negating the past trauma or current trauma, we still need to dig deep into the B12 and MTHFR and vitamin D. But the trauma does affect the expression of certain genes. It also, we see a lot of nutritional deficiencies after trauma due to poor digestion because the
Mm-hmm.
digestive enzymes and the hydrochloric acid kind of just shut down. And so, again, eating great food but not absorbing these micronutrients. So I've seen that years after trauma.
Yeah, it's really hard. I've worked with Dr. Mark Gordon, and he does a lot of trauma work for veterans, and he focuses a lot on the hormones that get affected because of the brain trauma and the head trauma that people experience in combat or the repeated shot firings and things like that, and how it correlates to anxiety. And then just balancing out some of those hormones can make a significant difference for them. And he's actually been tracking the reduction of some of the hormones as a result of those traumas. Have you seen similar things like that with mental health and hormones?
I haven't made that direct correlation, but what we see when we evaluate somebody with trauma is just, a kind of very wide range of metabolic abnormalities from hormonal to insulin resistance to nutrient deficiencies, again, that aren't dietary related.
Mhm.
So definitely somehow, some path from the trauma.
If you had to choose your most favorite cutting edge research or biomarker that you're most excited about right now in the world of nutritional psychology or psychiatry, what would that be?
Well, I counted there's 250 that we look at and when I evaluate a psych patient. But there's one that is so simple and has such profound implications, and that's looking at levels of cryptopyrrole in the urine.
Oh,
So it's a
yeah.
urine test. It measures this molecule, a pyrrole derivative, and most of us would have normal levels. And if it's elevated, it's likely a genetic vulnerability. But this cryptopyrrole just binds B6 and zinc.
Mm.
So you have this tremendous deficiency of B6 and zinc, and elevated cryptopyrrole is always associated with psychiatric symptoms, usually
Mm.
anxiety, but we've seen depression and panic and even paranoia. and it's simple to treat. We're talking about, pennies a day, B6 and zinc. The marker comes down and symptoms improve. I mean, it is really stunning and dramatic.
That is amazing because you're right. I mean, it's something that seems so simple and so inexpensive, oftentimes gets dismissed because we think that it's not going to do enough. But some of these things that biochemically are happening to people really need to start being addressed because the side effects that they're having with multiple layers of medications is not good for them either.
Yeah, the amount of medications
Oh,
now, because of our kind of ineffective model, is just exploding. So people are taking three, four, five
yeah.
psychiatric medications to
Mhm.
treat problem that sometimes there might be a simpler solution.
Can you share a case example of where an integrative approach really transforms someone's mental health when medication alone wasn't working?
Sure, many, but there's one that I just talked about a couple nights ago about a gentleman who, traveled around the country seeing integrative doctors as well as traditional doctors, had a bag full of supplements because every doctor put him on a different regimen,
Hmm.
and strong family history of depression and addiction. He struggled with depression and addiction and, could not get off antidepressants. He had a lot of blood work. Everything was normal. And the one test that we found in our battery was low levels of essential amino acids. So this was someone who was eating, organic foods and
Hmm.
grass-fed protein. So he was eating the perfect diet, but he was completely deficient in amino acid. So again, that inability to digest and absorb. So just by giving this individual hydrochloric acid, free-form amino acids, he was able to begin to feel better, and eventually we were able to taper him off these medications. So it wasn't dietary intake, it was a problem of digestion and absorption.
That is incredible because I don't think, even in the functional medicine world where we're focused so heavily on gut health, we are not making that correlation that people are not digesting their proteins to make amino acids, to make neurotransmitters. That thought process isn't happening with a lot of functional medicine practitioners either.
No, it hasn't. And maybe because it's too simple, it's not trying to look at 75 markers on organic acid. It's just
Yeah.
looking at, nine essential amino acids. Usually there's a pattern. They're either all low,
Hmm.
or normal or high, and that means something. So I remember when I first did amino acid testing, it was by mistake. I remember in the 90s, I checked the wrong box in a lab company, and it didn't make sense to me when I first started doing it. But now it is one of the most important tests that I do for adult depression.
How do those amino acids work with like that resistant depression, anxiety? What do they actually do that makes the anxiety and the depression worse?
Well, the essential amino acids, essential meaning our body needs to get them from our diet, are the precursors to every protein in the body. But in psychiatry, they're the precursors to the neurotransmitters.
Mhm.
So tryptophan, precursor to serotonin, phenylalanine, the precursor to dopamine and norepinephrine. So if those are deficient, and we have studies in humans and animals for going back, I think, to the 70s, that we can affect the levels of neurotransmitters in the brain. So low levels of these amino acids affect neurotransmitters. It's actually a research protocol called tryptophan depletion studies, where we give people in the lab low levels of tryptophan and we watch them get irritable, depressed, and angry.
It's interesting that we're willing to do that to people, right? But you've got to figure it out sometimes. You have to know that what you think is actually working.
Absolutely.
How do you guide patients to safely combine their natural approaches with their psychiatric medications?
Yeah, I think the vast majority of the work that we've been doing is all nutritional supplements or interventions that can be done with medication. So it's not an either or model when we think of functional psychiatry. It's just kind of adding tools, to the toolbox. There are very few interactions with medications. Sometimes high dose amino acids we won't use with certain medications, but all the vitamins and minerals and gut support that we're recommending can be utilized with medication.
That's awesome. Because I think there's a lot of fear around that, right? Like if I take this, it'll interfere with that. And some things, yes, they do interfere, but it's good for people to understand that they can do these things safely, but they need to work with somebody knowledgeable like yourself or somebody that has come from one of your training programs that really truly understands this.
Yeah, absolutely. It's an integrative model where individuals can sometimes it's just the medications work better. Other times it's a path to tapering someone off the medications.
For patients or families that are listening and they're really feeling frustrated by medication only solutions, where do you recommend that they start?
Well, I'll have to say my book. So, the book I just wrote, Finally Hopeful, is written for patients. And I think the title is the best part of it, hope. I think as you begin to appreciate the role of nutrition and depression. So there are some good books out there that on my website, psychiatryredefined.org, there's a list of clinicians. And in the next month, I'll be setting up a network of functional psychiatry clinicians so around the country that have been trained. So that program is called Finally Living Now. I think Finally
Uh,
Living Now. People want the information. Too many of our traditional docs just don't have the training. So we'll hopefully be able to provide a network of clinicians who can help.
That's fantastic. And for those of you who are driving or didn't catch those links, don't worry about it. We will have them in the show notes for you so you can find these people that have been trained and understand what to do to help you. What gives you optimism about the future of psychiatric and mental health care?
Well, the explosion of research is really have given me some renewed energy at this point in my career because in the last 5 years, there are just hundreds of incredibly well-written academic articles, references that our traditional researchers have kind of just validated everything that we've been saying for 30 years. So we have studies on vitamin D deficiency and suicide and zinc deficiency and suicide and folate and the gut. And the most significant for me is I've been talking about lithium orotate for
Mhm.
30 years as a nutritional intervention, probably the most important in my practice. And a study came out of Harvard this year describing lithium orotate, the only lithium preparation that was able to reverse Alzheimer's pathology in mice models and prevent it in these models. It was pretty dramatic studies.
Wow.
Long-winded answer, but it's the research now that is just supporting everything we've been yelling about for 30 years that just is going to make it much easier to train doctors and nurse practitioners so we can help more patients.
Oh, that's fantastic. I'm going to look up that study. That's amazing. So, one last question for you is if someone was listening today and they're really struggling with anxiety and depression and they're out of answers, what would you tell them to give them hope?
I think that, I've been doing this 30 years and I have colleagues around the globe, and everyone would kind of just echo that there are some simple interventions and to try to find either your primary care doctor or a mental health professional or a naturopath who will dig deeper and look at some objective tests. And I'm positive that if you're struggling with depression, that they'll find something to help you.
That's awesome. Thank you so much for joining us today. Are there any last thoughts that you want to leave with our listeners?
Well, just to repeat two things I've said a couple times is hope. Finally, hopeful is the
Mhm.
book, and everyone's different. And your neighbor might be taking, found out that they had a vitamin B12 deficiency, and that cured their depression. It doesn't mean you have a B12 deficiency, but there are many kind of paths towards looking deeper. Everyone's different, but there is.
Thank you so much for joining me today.
Thanks for having me. Nice talking with you.
Thank you for joining me today on Let's Talk Wellness Now and Dr. James Greenblatt for the insightful conversation on integrative psychiatry and the future of mental health. If you've ever felt dismissed, over medicated, or frustrated by cookie cutter approaches to mental health, remember there is always hope. Healing begins when we look deeper at nutrition, environment, biochemistry, and the unique story within every patient. That's the art and the science Dr. Greenblatt calls us back to. If today's episode resonated with you, share it with someone who needs to hear that mental health illness is not a life sentence. It's a message from the body asking to be completely understood. Remember, wellness isn't just about feeling good, it's about thriving in every area of your life. If you're ready to explore how root cause psychiatry or functional medicine can help you or a loved one find hope again, visit drgreenblatt.com and check out his new book that is just out. Until next time, I'm Dr. Deb, reminding you to take care of your body, mind, and spirit. Be well, and I will see you in our next episode. Welcome to Let's Talk Wellness Now, where we bring expert insights to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcast. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.